The Patient Protection and Affordable Care Act, health insurance reform, Obamacare, call it what you will. But making health care available to everyone in the country is an enormous undertaking. Most provisions will be implemented by January 2014, with the entire program in place by 2020. If you've been thinking that you can't quite get a grasp on the dollar amounts associated with the Health Care Reform Act, that's because they're not in yet, as insurance and investment professional Ron Stivers of Paducah explains.
Cost is the big issue that most people are going to be facing. Many people are going to be facing. We don't know exactly. None of the carriers have put any prices on it. The government itself doesn't have an insurance plan. Insurance companies are going to be participating either in the exchange or outside the exchange, and most of them both, to sell their products.
Of course, before one can obtain insurance, one must fill out forms. There's been widespread speculation that the application could be as many as 61 pages. Stivers says at this point that number is just a number, that the length of the application is yet to be determined. In part 2 of an interview with Ron Stivers, an insurance and investment professional in Paducah, he addresses a concern that some low-income individuals may have. That being, how can they really afford to purchase the required insurance? Stivers says this may be where subsidies come in.
Through the exchange is where you get the subsidies. An individual who might not have an income to a certain level would have the opportunity to have their premium subsidized. A person with an income low enough, they're probably going to pay very little for their insurance. In the past, they probably haven't had any, so it's going to be a real benefit to them.
Eligibility for subsidies will depend on percentages. If there is insurance available from your employer, what percentage of your paycheck is consumed by insurance premiums? If it's above a percentage that has not yet been definitively set, that employee will be eligible for a subsidy. It's a large task trying to understand a health insurance program that will affect tens of millions of people across the country. As with most health insurance programs, the cost is arguably the biggest issue that individuals and companies will face. Individuals may be concerned about whether or not they'll be able to pay for the insurance, and companies may be asking the same question. Ron Stivers, an insurance and investment specialist in Paducah, says all of the numbers, such as fees and penalties, are not in. But this much we do know about how the Affordable Care Act will affect employers. There is the shared responsibility portion of the program, which states that individuals who do not have insurance through their employer and are not eligible for programs such as Medicare or Medicaid choose a plan from available programs that suit their needs or pay a penalty, and companies with 50 or more employees who do not currently offer insurance will be required to pay a fee for each employee that must seek coverage somewhere else. And if a person is satisfied with the insurance they currently have at their employer, they're welcome to keep it.